Welcome to Raaonline. Today's topic of discussion is uterine tubes and ovaries. The competency of the topic is describe the position, features, important peritoneal and other relations, blood supply, nerve supply, lymphatic drainage and clinical anatomy of uterine tube, and describe the position, features, important peritoneal and other relations, blood supply, nerve supply, lymphatic drainage and clinical anatomy of ovaries. Before moving into the topic proper, let's discuss a case scenario. A 38-year-old female, a gravida 3, para 2, live 2, who presented to the emergency department with the complaints of or with a history of amenorrhea for the past 3 months. Her main complaint was generalized abdominal pain. On examination, she was clinically unstable and her abdomen was tender on palpation and diffusely distended. Her blood pressure was 90/42 mm mercury and pulse rate is 110 per minute. The digital pervaginal examination was positive for cervical motion tenderness and the moderate amount of free fluid is present in the pouch of Douglas. Her beta HCG levels was increased. The bedside pelvic ultrasound shows an empty uterine cavity as well as a live fetus floating in the abdominal cavity, which is surrounded by a moderate amount of free fluid. Her hemoglobin was 3.2 grams and her total WBC count was 7.5 gram per liter. What was the probable diagnosis? So here the patient is already married with 2 live births with a history of amenorrhea for the past 3 months. The beta HCG level is increased. So she is pregnant, but the ultrasound shows the empty uterine cavity. So ultrasound shows the uterine cavity is empty, but there is a free fluid surrounded by a live fetus which is present in the abdominal cavity. So what is the clinical diagnosis? Here this is the ultrasound investigation. Here this is the fetus which is present in the abdominal cavity, live fetus, and this is the fallopian tube. This is the empty uterus. Same patient after the postoperative. This is the specimen shows the 28 weeks of fetus with the placenta, and this is the tube, that is the fallopian tube. So this is the case of ruptured ectopic pregnancy. We will discuss this case scenario later. So let's see the uterine tubes first. Uterine tubes or fallopian tubes are named after this Italian anatomist, that is, as well as he is a priest, that is Gabriel Fallopius. The other name of this uterine tubes are oviducts or salpinx. So these are the uterine tubes. So it is a bilateral paired structures present on the either side of the uterus. So this is the uterus and it is located in the upper free margin of the medial 3/4 of the broad ligament of uterus. So this is broad ligament of uterus. These are ovaries. So this is ovarian ligament. This is the broad ligament of opposite side. So the uterine tubes these are the tubes are present in the upper free margin of the broad ligament on either side of the uterus. So this is the coronal section to see the uterine tube. So this is the uterine tube. So this is the uterine tube which is present in the upper free margin of the broad ligament, and this is the uterus. So let's see the external features of the uterine tube. So it has ends and parts. So the uterine tube has 2 ends. So this is the medial end, this is the lateral end. So it has 2 ends, those are medial end and lateral end. So the medial end is otherwise known as uterine ostium. The lateral end is otherwise known as abdominal ostium. So the median end is around 1 mm in diameter. The lateral end is around 3 mm in diameter. So the medial end is opens into the uterus. So this is the uterus. Just below the medial end there is attachment of this ligament of ovary. Okay. So the once again I repeat, the fallopian tube is present In the upper free, this is the posterior aspect of the uterus and the broad ligament. So the fallopian tube is present in the upper free margin of the broad ligament. It has two ends. So the medial end and the lateral end. The medial end is opens into the uterine cavity. So this end is otherwise known as uterine ostium. The lateral end extends beyond the attachment of the broad ligament and opens into the pelvic cavity. So this end is otherwise known as abdominal ostium. So the diameter is 1 mm for median and the 3 mm for lateral end. Let's see the parts of the uterine tube from medial to lateral aspect. The fallopian tube or uterine tube has 4 parts. From medial to lateral aspect, the intramural part. The intramural part is otherwise known as interstitial part. The second part is isthmus. The third one is ampulla. And the last one is infundibulum or fimbria. So these are the parts of the uterine tube. Let's see the parts. So this is the intramural part or interstitial part. So the intramural part is present within the uterine cavity. So this is the intramural part, which is around 1 cm in length. The next to the intramural part is the isthmus part, which is around 2 or 3 cm in length, which is 3 cm in length. And next one is the ampulla. So the most of the length of the uterine tube is the ampulla. So the ampulla occupies more than half of the length of the fallopian tube, which is around 5 cm in length. Then the infundibulum is around 1 to 2 cm in length. So the total length of the fallopian tube is around 10 cm, in which the intramural part is 1 cm and the infundibulum also occupies the 1 cm. So the more than half of the length is occupied by the ampulla. So this is the infundibulum or fimbria. Because in the lateral end we can see the finger like projections like a fimbria. So this end is otherwise known as fimbrial end. So once again I repeat, from medial to lateral, the intramural part, then the isthmus part, then the ampulla, then the fimbria or infundibulum. Infundibulum is like a funnel like structure, so it is called as infundibulum.